eating disorders are rarely just about body image or food. Often there's a lot more tied into it, issues around difficult emotions, problematic relationships, and issues around control. This video is going to cover what eating disorders are, why they start, what they look and feel like, and importantly, what you can do to get help. If you're new here, a warm welcome. My name's Sil. I'm a junior doctor from Australia and I work in the field of mental health. I make these mental health educational videos in my free time, and this video is all about eating disorders in teenagers. Let's get into it. What is an eating disorder? Well, to start off with, it's probably helpful to say what it is not. And an eating disorder is not a choice. Okay, eating disorders are multifactorial mental health and physical illnesses that all fundamentally involve some unhealthy, unhelpful relationship with food, and that this relationship ends up affecting other parts of life. So your physical health, your relationships, your ability to get to school, to get to work, and that sort of thing. Now, there are actually many eating disorders. We're not going to go through every single one, but some of the common ones we see are things like anorexia nervosa, and this is when someone has a restrictive oral intake. They reduce the amount of food they consume, and they might also purge, not always, and purging is the kind of medical term for vomiting. It can also involve other ways to cut down calories, so things like using laxatives or over-exercising. And really in anorexia nervosa, there is significant drop in weight to the point where it becomes unsafe. Another common eating disorder is bulimia nervosa, and this is when after eating there is purging, which usually involves vomiting, and the eating tends to occur in a kind of binge pattern. So maybe avoiding to eat for most of the day and then losing control and having way more than you intend, not really having control over what's going in, eating, and then often there's followed with a deep sense of shame and recrimination, like a self-attack, basically shame, and then purging. So either mechanically forcing yourself to vomit, or often there can also be laxative abuse as well. And on the note of binging, there is actually something called binge eating disorder, which is characterized by frequent loss of control with eating and just having far more than what was planned, and eating to the point of just feeling very ashamed multiple times a day sometimes. And there's something called ARFID, which is Avoidant Restrictive Food Intake Disorder. And this is different to the others because it's not about body image or losing weight or kind of body dysmorphia type things. It's more about the textures and associations with food. So if someone has previously choked on a green pea, for example, then they might not be able to eat green foods anymore. But I guess a point I want to make about all these disorders is you do not need to be underweight to qualify for having an eating disorder, and you don't need to be underweight to get help for disordered eating. And in fact, it's far better to get help before someone is underweight, because once someone gets to a point where they're medically unstable or unsafe, then the options of treatment become more and more narrow and more assertive, so more and more intense basically. So a really important question, a really good question, but a question we don't have the whole answer to scientifically is, why do eating disorders start? Look, being a teenager isn't easy. There's all these stresses associated with you becoming an individual and separating from the family, associated with you becoming independent and making new friends, school, work, relationships, puberty, all these things interrelate to make for a very stressful time. And the part of the brain that regulates stress is not fully developed. And so that's essentially teenagehood. Being a teenager puts you at an increased risk of multiple mental illnesses because of this stress to regulation imbalance. But when we're working from the kind of psychiatric perspective or the mental health perspective, we tend to think about things in terms of biological factors, psychological factors, and social factors. And these three things kind of all contribute to explaining why one person might have issues with eating. So if we break these factors down a bit further, biological factors, really things around genetics, and there does seem to be an association with having parents who have an eating disorder and then children also having an eating disorder. Now, whether this is child's being exposed to disordered eating in how they grow and model their parents, whether it's just genetics. It's very hard to disentangle that, but there likely is a genetic component. Psychologically, people who have what's called a kind of neurotic or perfectionistic temperament are more vulnerable towards eating disorders. So these are people who are kind of like highly strung, slightly anxious, really value control, perfectionistic, these kind of traits. And on that point of control, this is really important. Often teenagers who are kind of growing in independence psychologically might feel like they don't have much control in their life, especially if there's stress in the family or someone's become ill or there's a divorce or things that are beyond your control. These can be extremely difficult to deal with, and sometimes it can feel like the only thing you can control is the food in front of you. That's the one thing in your life that you have some control over, what you put in your mouth, what you ingest. And so for some people with eating disorders, it can be really around controlling that element of their life. Other psychological considerations can be that sometimes disordered eating is about avoiding painful emotions because the malnutrition state of the brain can feel numb and prevent the emotions from being felt fully. So it's kind of like the pain of the malnutrition is preferred over the pain of the emotions. That's very understandable, but it's quite unhealthy because eventually you're going to have to feel the emotions. Emotions need to be felt. And often when the calories do eventually come in, those emotions are felt much more powerfully because they've been suppressed in a kind of unhealthy way for so long. But with the right supports and treatment, which we're going to talk about, this can be done in a safe and supportive way. Now, moving on to social factors, we've kind of alluded to some. I think, being in a household with high expressed emotions is a risk factor. So that means that there's lots of shouting, very strong emotions, lots of kind of drama and dynamics and stress. So that kind of stuff can increase the anxiety and the stress that can then manifest into an eating disorder. And of course, we have to comment about social media. Gosh, the false, fake representations of what bodies are meant to look like that are often artificially enhanced to give us fake expectations, which can be really unhelpful. So what can eating disorders look like and feel like? Well, eating disorders can be kind of sneaky, and you might be able to kind of hide it from your family or your friends. I wonder if you feel you might be hiding it from yourself in a way. But here are some things to look out for, okay? Number one is constantly thinking about food. If you cannot get your mind off of food, if it's all that your brain kind of focuses on, even when you're doing other things like, going for a walk or talking to a friend, or, doing homework, if your mind keeps thinking about food, either what you're going to be expected to eat later at the family dinner, or what you've already eaten in the day, and you can't kind of break that cycle of thinking, that's called kind of ruminations, when your brain just keeps going in circles around certain focus points. And it's also called salience, when certain topics are just so dominating and important that your whole mind is engulfed around it. That's a kind of red flag. You should be able to have balanced internal experience in your mind, thinking about lots of different things. But if all you think about is food, then that's a red flag. Number two is skipping meals and lying about it. So if you find that you've been eating less, you got your lunchbox, you chuck the food in the bin, but you're telling your parents you ate, then that could be a red flag as well. Number three is if you're eating and you're feeling incredibly anxious, or after the meal you feel very ashamed, these are red flags that need to be explored as well. And then the final point is changes in yourself. So you might find yourself getting more irritable and angry and or worsened anxiety. And that could be the fact that, the brain is starved and actually not able to regulate itself because the brain needs calories to function normally. You might also find physical symptoms like your body is getting colder, like you can't hold heat anymore, or you're just fatigued all the time. And those two are manifestations of just not having enough calories to warm yourself up or to feel energetic. But in terms of how it feels for someone with an eating disorder, it's very wide-ranging. Some people are kind of in denial and don't feel like it's a disorder at all, even though the numbers and the kind of facts on the scale or in the blood tests say it is extremely unsafe. Others are quite proud of the control and the discipline and their ability to be surrounded by food in a culture that's so focused on food, but to have the discipline and control to restrict. But that can be maladaptive or unhelpful because it's getting to a point that it's unsafe or unhealthy. Some people say they feel really numb, like they're in this kind of vague suspension and empty space, and that's preferable over feeling very difficult emotions when they're well nourished. Some people feel like they don't deserve food, like they don't deserve to eat, and some people feel like they just can't eat, like it's a physical impossibility, and that people just don't get that. So all these kind of experiences, they come together to really symbolize an internal state of shame and anxiety and pain, and I guess it's just important to kind of separate out what is the eating disorder and what is the self, and realizing that you are not your eating disorder. Interestingly, actually, I have met some patients who give their eating disorder, like say it's anorexia nervosa, they give that voice a name to kind of help identify when it's the anorexia speaking versus when it's the actual person and their kind of long-term goals and, the sensible, I guess, quote unquote, part of the brain. So now let's talk a little bit about recovery and treatment. And if you feel like this isn't the right time for you to start getting help, you do you. I'm not here to tell you what to do in your life, but it can still be helpful to watch just so that you know what the options are, and so you're better informed to make decisions that are consistent with what you want in life. The first thing to say is that recovery is absolutely possible, but it's very hard to do alone. So I would strongly recommend that the first point of call is to talk to a GP, because you just got to check that the organs are all working well, to make sure that there's enough electrolytes in your blood so that cells can work normally and so that organs don't shut down. Because as I said, if those kind of symptoms start, then the options of all the things we can do get narrower and narrower, and we have to focus on that first before we can be more holistic. The other things GPs are great with is they can refer you to local support services. If you don't feel ready to go to your GP, there are other services that are available online that you can, you don't even need to call them. You can, but you could also just kind of online message them. And these are things like the Butterfly Foundation, Headspace, Kids Helpline. They're all free. Your parents don't need to know about it. You can do this without their awareness. You can just do it yourself, and they can help you take the right steps in the right direction for your recovery. But I think telling someone is really important. So whether there's a school counselor or a kind of school psychologist or a parent that you trust, that could be really helpful. So in terms of treatment for eating disorders, it's essentially the blend of therapy and medications, but medications we tend to try and avoid in teenagers and really focus on therapy, and you can get awesome outcomes with therapy, but if needed, they can both occur, in conjunction. The therapy are things like cognitive behavioral therapy for eating disorders, or it's kind of CBT-E or enhanced CBT. This is a kind of therapy that works with the person to identify unhelpful thinking patterns, getting really good at identifying them, and then developing strategies around how to target them. So identifying maybe perfectionistic traits and thoughts, and then developing strategies on how to kind of be more realistic and kind with the self. Look, there's also family therapy, which is very evidence-based, and lots of other types of therapies too can be helpful. Working with your psychologist or with your service, you'll find out what's best for you. And then there are medications that, there's no one medicine that fixes eating disorders. And so that's complex, and essentially that needs a doctor. But I'd just say that, the best evidence is the combination of both if you are needing medicines. All right, look, I wasn't sure to include this or not, but I think I have to because it's a really important note. Eating disorders have one of the highest lethality amongst mental illnesses. And what that means is they have one of the highest rates of death associated with the illness of all mental illnesses. And so it's really important that you don't do this alone, that you get treatment, because if it's well treated, that risk of death drops significantly. But at the end of the day, no matter what you think, no matter how you feel, organs need calories to function. And if they're not getting enough, then you can have catastrophic consequences. So please do get help. If you found this video important, then liking it can help the YouTube algorithm share it with other people. And other than that, I just wish you all a wonderful day full of love and connection. And I wish you the best with your journey. I'll see you in the next video. All right. Bye for now.